We're going live in just over a minute, as you can see. This is the COVID-19 Scholar Peer Hub and the live ideas, bringing you really a kind of ideas engine for immunization staff fighting to maintain immunization services to keep vaccination going during the pandemic. So if you're joining us now, a warm welcome. We're not heavily promoting these, so it's really for our most loyal Facebook followers. We know who you are, and there are new ones joining every day. We just passed the 3,000 mark in terms of the number of people who have liked our page. We hope you find this Live Ideas Bulletin useful. You'll be hearing, of course, from Charlotte Mbu, who is leading this initiative on behalf of the Geneva Learning Foundation. See you soon. Warm welcome to you from Geneva, Switzerland. I'm Reda Sadki from the Geneva Learning Foundation. It's time for the COVID-19 Peer Hub Ideas Engine, a daily bulletin, three times per week, we decided. We have over 700 projects that have been developed by immunization staff working in countries at both national and subnational level. And in each of these bulletins, we're going to be as in line with the aims of the Peer Hub, sharing experience, spreading ideas, and taking action to keep vaccination going during the pandemic. Want to greet Giraudoux Sodegla, who says hello, Reda, who is from Benin. Welcome, Giraudoux. And I want to say hello and welcome to Charlotte Mbu. Charlotte, how are you doing today?
I'm doing great, Reda, and it's always a pleasure for me to be here hosting this Live Ideas Bulletin with you. And I'm excited today because we are having two guests.
Okay, all right. So can you tell us a little bit about who they are before they introduce themselves? What country, what do they do, and how are they involved with the COVID-19 response?
All right, they are two scholars from the COVID-19 Peer Hub. We have Obed Philip Niobe, that's coming from Ghana, works at the municipal level in immunization. And we also have Abdelatif Sheikh Abdullahi. He happens to be the country team leader for the Somalian Scholar Country Group, and we are honored and grateful that he accepted the invitation to be part of today's session. I'm not going to go into the details, but one thing that is particular about both of these scholars are they were facing the same immunization challenge due to the COVID-19 pandemic, and I'll leave it to them to go into the details during today's session.
COVID-19 Peer Hub, we're sharing experience, spreading ideas, and taking action to keep vaccination going during the pandemic. Charlotte, what is your first question for Abdelatif and Obed, respectively from Somalia and Ghana?
All right, thank you, Reda. So I would like to invite both you, Abdelatif and Obed. First of all, Abdelatif, can you introduce yourself? Tell us where you work. Tell us in a few words your immunization challenge and the specific objective you set out to address that challenge.
And Obed, if you could greet Dupe Akinsanya Orolug Bagbe, who has just joined on Facebook and says good afternoon.
Good afternoon to you, Dupe. Over to you, Abdelatif.
Thank you, Dr. Charlotte and Dr. Reda. I'm very glad to join in today's meeting. I'm from Somalia, subnational level. My position in public health and disease control director, Minister of Health, Hirshabelle State of Somalia. And also I am Somali country and team leader. Thank you.
All right, over to you, Obed. Can you introduce yourself?
Thank you very much, Charlotte. I'm Obed Philip Nobe, a health information officer working at Agunam Kwanta, Hunter West Municipal, Western Region, Ghana. happens to be the COVID-19 focal point and also part of the coordination team for the Ghana Scholar team.
If you're
That's so
watching us
great.
on Facebook, please tell us what city as well as the country you're connecting from. And hello to Tanushri Mandal, Halima Toro, Lavele Sumbo, and Rajat Garg. So India, Nigeria, Ghana, we already have quite an international audience out there.
Yeah. Okay, so I'll ask you, Obed, can you tell us what immunization challenge that you were facing within the context of because of the COVID-19 pandemic and that you sought to address by joining the Scholar Peer Hub?
Thank you very much, Charlotte. From the start of the pandemic, our immunization coverages were improving as it used to be every year. But somewhere when we started getting the cases, then we started seeing a decline in our immunization coverage, more especially in one particular sub-municipal. So my project was now looking at practical steps that can be used to improve, in fact, specifically Penta-3 coverage in Aguna sub-municipal in the Hunter West municipality in this era of COVID-19 pandemic. And that was what I was looking at. And in this period, I was just looking at how these children that have been missed, how we can list all of them and track them to be able to vaccinate them, even during this pandemic, Charlotte.
All right, I'm going to turn towards Abdulatif right now to ask him the same question. What's your take, Abdulatif? What was your immunization challenge? And what did you set out to do to address this?
Thank you, and Dr. Charlotte. And the last two decades, immunization. There is a more immunization challenge in Somalia, and because by side of and political instability, by side of inaccessibility for issues for some places and difficulty. So, and our immunization challenge was, our immunization program or immunization coverage was very low. And also in a 20 districts in Somalia, lack of access or no accessibility or no immunization services that cause persistence low immunization service or immunization coverage rate in Somalia due to political instability, conflict, also and hesitance and about vaccination coverage, misinformation and mistrust, lack of awareness, natural disaster like floods. Now, and this time
please,
we are
Abdulatif, I want to find out how was this accentuated by the COVID-19 pandemic? Was the situation not affected at all, or was it made worse by the pandemic?
And Somali immunization coverage rate and face challenge during COVID-19 because healthy workers, healthy resources have been changed to COVID-19 response, and also parents and they are reluctant and to take their children for health facility due to fear of exposure to COVID-19. Also vaccination and challenge about lockdown and travel restriction. So routine immunization and declining and nowadays.
All right. So, tell us concretely, what have you done to address this issue?
To solve this issue is in my project or my challenge in BIRHAP was declining routine immunization services or SI in Somalia during COVID-19. And I take orienting stakeholders and community leaders, religious leaders to participate fully on routine immunization services, also capacity building and healthy workers on routine immunization, and to keep immunization going. Also to train and collagen and operatories and doing and regularly supportive supervision. Thank
All
you.
right. Thank you, Abdulatif. I'm turning towards you now, Obed, to find out from you. You talked about trying to carry out activities that will increase the Penta-3 coverage in your municipality. So concretely, what were the actions that you prepared for yourself to implement within your context to see that there is a rise in your immunization coverage?
Thank you very much, Charlotte. Indeed, when you look at the Penta-3 coverage that I was talking about earlier, in Aguna sub-municipal, we saw that in the 2020 half year, we had 44% from the previous 2019 of 54.2%. And this has never happened in a municipality for the past 4 or 5 years. And we associate it to this particular pandemic. And based on that, we intensified our meetings with the immunization professionals, even during the pandemic, obeying all the protocols. So every month, we make them bring all their registers, their immunization registers, so that we look at what exactly they have captured and what has been reported, and then strategize with them how they can get these children in the municipality. And in fact, it has been very excellent. And throughout this period, the knowledge that we gain in it, we were able to implement the SIA that we just conducted successfully. And Aguna sub-municipal, even though we still have some children not vaccinated, but we have been able to make plans on how we are going to enlist all of them from the immunization registers and track them for the next 4 months or so ahead of us.
So talking about SIA, means supplementary immunization activities, what did you do differently in this SIA within COVID-19 context that was not usually done in the previous SIAs when things were normal, in quotes?
Great, Charlotte. In fact, for the first time in the Ahanta West municipality, we had meetings after every day for the from 10th up to 13th when we started the session. We normally do Zoom meetings every evening with all the supervisors and even including the WHO reps that visited the district and were supporting us throughout the period, in addition to the regional teams that were here. This has never happened before. And we were able to get all the issues around the immunization sessions for each day, whatever went wrong, whatever that is not need to be updated for the supervisors, down to the immunization staff who are vaccinating the children. So this was exceptional in all our SIs that we have conducted. And based on this meeting, we are able to present to them graphs each day, their performance and how we want them to perform the following day. And Charlotte, interesting, this was the first time we also introduced a reward system to the communities. So each day we look at we have selected indicators that we watch out for and award communities that have high coverages, who have their stakeholders involved, who are able to mobilize them, sensitize them very well. We award them.
All right,
and awarded supervisors as well.
Thank you very much, Obed. We are having our very first question from Facebook, so I'm going to turn towards Reda, who is going to read out the question for us.
Sure. Thanks, Charlotte. So it is our friend Rajat Garg, who is one of our faithful Facebook followers, and we really appreciate his involvement. His question is the following. I don't know if it's to one or both of our guests. Are there any PPE kits provided to vaccinators? What precautions were advised to them? So a question about PPE is an important one. Charlotte, back to you.
Yes, and thank you, Rajat, for that question. I think it's quite pertinent. So I'm going to start with Abdilatif. Please go ahead and tell us PPEs for vaccinators and precautions taken to ensure that they are safe. What is done in Somalia? Abdilatif?
Thank you, Dr. Charlotte.
Just a
And we
correction.
encourage
We
all
don't. We
health.
can't ask Abdelatif for all of Somalia, but to ask you,
Yeah.
Abdelatif, specifically where you work, in your context, what is the situation with PPE? And we also realize it can be a sensitive and a political issue, so let's keep that in mind as well.
Exactly.
Thank you, Dr. Reda. Thank you, Dr. Reda. In Hirshabelle, and now we are doing an SI, polio SI, and campaign. So, and we encourage all and health workers or EBI staff and to take BBE and equipments and also and sanitizers also to and vaccination going and to avoid COVID-19 disease. And all we encourage and we educate and we train and health professionals, all health EBI staff and all and staff working and this and vaccination. And all of them, they have BB equipment and sanitizers. Thank you.
Okay, thank you, Abdilatif. Obed?
Hello, Charlotte.
Yeah, please go ahead.
Yes, with respect to this particular SIA that was conducted, I think I left that. This is the first time that we are conducting an SIA where our vaccinators and then community members that were selected to support the vaccinator in the community were wearing what? Nose masks. Each team were given two set of nose masks and then also sanitizers where they sanitize. And in fact, like the campaign is we don't touch the child, don't come direct into contact with the child in any way. So that was how we were able to maintain the protocols and carry out the SIA successfully.
All right, so thank you both, Abdilatif and Obed. Philip, Reda, the time goes so fast, but I would like to ask one last question while apologizing to those who are watching from Facebook for going over the 15-minute mark that's set for this session. I just want to ask both our guests one last question concerning their peer hub experience. That what made a difference for you participating in the peer hub? That has to do with the maintaining and ensuring continuity of immunization services within your context and in the face of the COVID-19 pandemic. So we'll start once again with Abdilatif and then with Obed.
Thank you, Dr. Charlotte. And Beer Hub, my experience about Beer Hub is a platform that sharing experience and spreading an idea and knowledge and taking action to keep immunization going. So as a Somali country team leader, we take part and encourage all my country and team to share our idea, our experience, and to take all over the world and expertise from their idea, and also to share our idea about Somalia. So, and also I'm working to encourage my country team to be active and motivating and advising and to be active and participating in Beer Hub. This is a very fantastic platform, and we are thanking Geneva Learning Foundation for their efforts and experience for this program. Thank you.
We actually thank you for your participation and your engagement and commitment, Abdilatif. Obed, Philip?
Yes, Charlotte, indeed, when you look at the peer hub that was launched, it came at a critical point where we needed much insight, what to do, what exactly actions that we will take that will not, at the end of the day, affect us, immunization professionals. So I saw it as an avenue for ideas, knowledge sharing, where in fact I went into the ideas engine and I was able to get some ideas. When we were doing the SIA, we actually applied some of them. That has to do with in communicating with communities. And some of the assembly members in our jurisdiction here supported so much such that it was amazing. And when you look at the peer hub, it actually gave us more resources, more information. In fact, the experts there help us in so many ways. There is nothing you will lack once you are here, unless, of course, maybe you are not able to connect. And even if you are not able to connect here, there are several other ways. And it also afforded me the opportunity to bring on board other DHMT members to join the sessions that normally go on during Facebook Live. And I think they are all amazed at it. And a scholar program, you see most of my people join. And for the first time, about 6 people from my municipality are taking part in this peer hub activities. Thank you very much, Charlotte.
Really, I want to thank you once again, Abdulatif Sheikh Abdullahi and Obed Philippe Nobe, for accepting our invitation for today's session. And thank you, Reda. Over to you.
All right, that's it for today. We try to keep these short. Here we went 5 minutes over. Don't hold it against us. We have a lot to share. 700 participants, 700 projects that were developed and peer reviewed during the first 6 weeks of the COVID-19 Peer Hub. Join us. So, Charlotte, we're doing these 3 times a week. However, tomorrow is the commencement event, so we might be skipping tomorrow's live Ideas Engine Bulletin. Join us then on Thursday at this same time, or just watch the recording at your own leisure afterwards. That's it. Thank you so much, and see you tomorrow for the commencement event. The participants in the Peer Hub in the COVID-19 Peer Hub have started what is called the Impact Accelerator Launchpad. So we'll be telling you more about that during the commencement as well. And we'll see you Thursday to invite more immunization staff from everywhere in the world. We don't know where Thursdays will be from, who will be sharing their experience, what they have done in practice to keep vaccination going during the pandemic. Thank you and goodbye.